I'm a pharmacy technician in Manila, and 3 months back, this American woman walks into our clinic dragging 2 massive suitcases. She's sweating through her shirt, looking around like she's smuggling contraband. And when I ask if she needs help, she leans in close and whispers, "I'm here for the knee." Turns out she flew 18 hours from Wisconsin for a total knee replacement. The surgery, hospital stay, physical therapy, flights, and 2 weeks in a beach resort came to $14,000. Back home, her insurance quoted her $55,000 after deductibles. When I mentioned she could have just submitted the paperwork to her insurance for reimbursement, she laughed so hard she nearly knocked over the medication display. "Honey, my insurance specifically excludes foreign procedures unless it's a life-threatening emergency. They'd rather I pay full price in Milwaukee." She showed me her surgeon's credentials, trained at Johns Hopkins. Published in medical journals, 15 years of experience. "This guy's better qualified than my surgeon back home," she said. "And I'm saving enough to remodel my kitchen." My cousin works as a medical interpreter in Bogota. And last year, an American couple showed up at his hospital looking terrified. The husband needed emergency dental work and abscessed molar that had gone septic. They'd been on vacation when it happened, and the hotel concierge called an ambulance. The couple kept refusing transport, saying they couldn't afford it, until the husband passed out from fever. The ambulance ride cost $45. When my cousin translated the bill, the wife started crying, asking if there'd been a mistake. In Denver, an ambulance billed $3,800 United States dollars for a 6-mile trip when our son broke his arm, she said. The husband's emergency dental surgery for antibiotics. An overnight observation totaled $340. Their travel insurance covered the whole thing. The wife kept asking my cousin if the hospital accepted tips because she couldn't believe the care was real. I work admissions at a private hospital in Bangalore, and we've got this American businessman who flies in quarterly for his diabetes management. He gets his HbA1c checked, meets with an endocrinologist, picks up a 3-month supply of insulin, and flies home. Total cost, including his business class tickets, is less than 6 months of insulin in Boston. He told me his insurance covers the tests, but considers insulin a maintenance medication, with a $500 monthly copay. Here, his entire supply costs $180. I'm literally paying less to fly to India 4 times a year than to walk into a CVS, he said. The man travels 8,000 miles, because it's cheaper than driving to his local pharmacy. My brother manages a medical tourism office in San Jose. And this American family arrived last month for the father's hip replacement. They'd researched everything: the surgeon, the facility, the success rates. But the day before surgery, the father pulled my brother aside, looking stressed. "I haven't received any bills yet. When does the collections department contact me?" My brother explained they'd get one itemized bill after discharge. The father didn't believe him. "In Florida, I got 17 different bills from my gallbladder surgery. The surgeon billed separately, the anesthesiologist billed separately, the hospital billed separately. Some company I'd never heard of billed me for facility fees, and none of them matched what insurance said they'd cover." He'd brought a accordion folder with payment records from that surgery bills arriving for 8 months. Half of them marked final notice, despite being the first notice. My brother showed him the hospital's transparent pricing sheet. Surgery, anesthesia, 3-night stay, physical therapy, medications, and all doctor fees, one price paid before discharge. The man stared at the paper like it was written in ancient Sanskrit. "I'm a medical billing specialist in Amsterdam. We had an American graduate student nearly have a breakdown in our office. She'd cut her hand badly in a cycling accident and needed 12 stitches. The entire visit of care x-rays to check for bone damage. Stitches, antibiotics, tetanus shot, and follow-up appointment cost €280. Her Dutch insurance covered it completely. But she kept insisting there'd be more bills coming. The hospital hasn't billed me yet. The radiologist will bill me separately. The ER doctor will send a bill. There's always another bill." She'd set aside €2,000 in her emergency fund, convinced she'd need it. I explained that in the Netherlands, hospitals aren't allowed to send surprise bills from out-of-network providers. Everything is bundled, coordinated, paid through her insurance. She made me put it in writing, notarized, because she'd been traumatized by a similar cut in Texas that generated $4,700 in bills over 3 months, different codes, different providers, different collection agencies. I got billed $800 just for the emergency room doctor to look at my hand before stitching it, she said. They called it a consultation fee. My aunt works for the National Health Service in Edinburgh. And she's got this American exchange nurse who cannot grasp how prescription pricing works here. The nurse needed an inhaler for her asthma. And when my aunt told her the prescription charge was £9.90, regardless of the medication, the nurse accused her of lying. There's no way. In Georgia, my inhaler costs $380 without insurance, $75 with insurance. You're telling me every prescription costs the same? My aunt showed her the NHS website. Antibiotics, insulin, chemotherapy drugs, heart medication, inhalers all £9.90 per prescription for working adults, free for kids, seniors, and low-income patients. The American started calculating on her phone, muttering about her various medications. I spend $400 a month on prescriptions back home with insurance. Here I'd spend £40 for everything. When my aunt confirmed this, the nurse asked if she could extend her exchange program indefinitely. She'd already looked up immigration requirements. I'm a surgical coordinator in Krakow. And last spring, an American couple came in for the husband's spinal fusion. They'd saved for 2 years, researching surgeons across Europe. The wife was obsessed with credentials, asking about our surgeons' training, publications, malpractice history, hospital infection rates, and equipment standards. All reasonable questions, which we answered thoroughly. Then she asked, what happens if something goes wrong? Do we pay extra for complications? Our surgeon explained that complications are covered if the surgery requires extended care or revision. It's no additional charge to the patient. The wife literally grabbed her husband's arm. Did you hear that? They don't charge you more when they mess up. She told us about her father's surgery in Arizona, where a surgical site infection led to 3 additional procedures and $87,000 in bills. Insurance covered part of it, but the family paid $31,000 out of pocket because the extra surgeries exceeded their policy's annual maximum. They charged us to fix their own mistakes, she said bitterly. Here, the entire surgery with a week's hospital stay cost less than her father's infection treatment alone. I work at a hospital pharmacy in Melbourne, and this American woman comes in with a prescription for some basic antibiotics after a dental procedure. I tell her that'll be $12, and she hands me her credit card looking suspicious. For the whole course? She asks. I confirm yes, the complete 7-day course. She doesn't move, just stands there waiting. After a minute, she asks, what about the dispensing fee? The consultation fee? The processing fee? I explain there aren't any additional fees. The price I quoted includes everything. She starts laughing, then crying, then laughing again. Last month, I paid $340 for the exact same antibiotic in Michigan. The pharmacy charged me $35 just to count the pills and put them in a bottle. When I asked why it cost so much, the pharmacist said, insurance doesn't always cover antibiotics. She showed me her insurance card as supposed. Premium plan through her employer. I have a $5,000 deductible that resets every year. I basically pay full price for everything except annual checkups. She bought 3 extra courses of antibiotics to take home, spending $36 total, explaining she'd rather stockpile than face another Michigan pharmacy. My cousin runs a medical clinic in Bangkok, and he's got this regular American patient who comes in quarterly for routine blood work. The man's in his 60s, managing high cholesterol and blood pressure. Complete metabolic panel, lipid panel, A1C test, liver function, kidney function, the works. Total cost is $85. Results within 24 hours. Last visit, the man showed my cousin a bill from his doctor in Seattle for identical tests, $2,300 before insurance, $820 after insurance because he hadn't met his deductible. The lab and my doctor's office are literally in the same building, he said, but they bill separately. The lab charged $1,800. The doctor charged $500 for interpretation and consultation, which was him spending 30 seconds saying my numbers looked fine. He now schedules his visits to Thailand around these blood tests. His wife comes along, they stay in a nice hotel, eat amazing food, see the sights, and it's still cheaper than one doctor's visit in Seattle. I'm medically incentivized to vacation internationally 4 times a year, he laughed. That's insane. I'm a surgical nurse in Prague, and last year we had this American patient. A young teacher who needed her gallbladder removed. Standard laparoscopic procedure. Afterward, while recovering, she kept asking about additional charges. What about the anesthesiologist? The surgical team? The recovery room? The medications? I explained everything was included in the surgical package we'd quoted. She pulled out a notebook where she'd listed every potential charge based on her research into U.S. billing practices. She'd identified 47 different line items that might appear on an American hospital bill for this surgery. In Texas, my friend had this same procedure. The hospital billed $32,000. Insurance negotiated it down to $18,000. But she still owed $6,000 after her deductible and coinsurance. Then surprise bills kept arriving: the pathology lab, the surgical assistant, the anesthesiology group. She ended up paying $9,500 total. Our patient's entire cost, including 3 nights hospitalization, was $3,200, which she paid up front from her savings. I'm saving more by flying to the Czech Republic than by using my insurance in America, she said. Shaking her head, my father's a general practitioner in Toronto, and he's got several American patients who drive up from Michigan and New York for basic care. One woman makes the 4-hour drive every 2 months because she can see my father for $120 cash, get prescriptions filled for a fraction of U.S. prices, and still spend less than her insurance copays back home. Her insurance has a $60 copay for primary care visits, and her medications cost $400 monthly with insurance coverage. In Canada, paying out of pocket, she spends $240 for everything. I'm literally better off having no insurance and driving to another country, she told my father. She'd calculated her annual costs: $7,200 using insurance in Michigan, $3,200 driving to Toronto 8 times a year, including gas and occasional hotel stays. That's a $4,000 vacation fund I'm saving by medically emigrating, she said. My father's practice sees 20 to 30 of these cross-border patients monthly. They're not seeking specialized care, just routine medical attention that costs less internationally than domestically with their own insurance. I'm an ambulance dispatcher in Copenhagen, and we had an American tourist collapse near Tivoli Gardens last summer. Classic heart attack, symptoms: chest pain, shortness of breath, sweating. Bystanders called emergency services immediately. Our crew stabilized him, transported him to Rigshospitalet, one of Scandinavia's leading cardiac centers. Full workup, medications, overnight observation, cardiology consultation. He was fine. Panic attack triggered by dehydration and stress, not a heart attack. When billing reviewed his case, the total came to around $400. The man's wife called our office crying, thinking we'd made a mistake with the decimal point. The ambulance alone should be thousands, she insisted. I explained Danish emergency services are publicly funded. Residents pay through taxes, tourists pay minimal fees. She told me about her neighbor in Ohio who'd called 911 for chest pain. The ambulance ride was 8 miles, 12 minutes. It cost $3,400. Insurance covered $600. He sold his truck to pay the ambulance bill, she said. He didn't even get admitted to the hospital. They ran tests in the ER and sent him home. Total bill was $18,000. I didn't know what to say. My sister works at a public hospital in Lisbon, and an American backpacker came into the ER after falling off his skateboard. Nasty head wound, possible concussion, CT scan, 6 stitches, tetanus shot, observation for 4 hours, discharge with pain medication. Total bill, €140. The kid didn't have travel insurance, pulled out his debit card, paid cash. Then he asked my sister, when do the other bills arrive? The radiologist, the ER doctor, the lab? My sister explained, Portugal doesn't bill that way. One service, one bill, everything included. The American showed her his phone where he'd photographed bills from a similar skateboarding accident in California 2 years prior. The ER visit generated 19 separate bills over 6 months from different providers, labs, and specialists. Total was $12,000. His insurance covered $3,000, claiming the CT scan was medically unnecessary. Leaving him with $9,000 in debt he was still paying off. "I can get hurt cheaper in Europe than I can stay healthy in America," he said, and I couldn't argue with him. "I manage a pharmaceutical warehouse in Mumbai, and we export generic medications to pharmacies worldwide. Last year, an American doctor contacted us trying to bulk order insulin for his patients. He runs a free clinic in rural Mississippi, serving uninsured farm workers. He explained that generic insulin in the U.S. costs $80 to $300 per vial, depending on the brand. His patients need 2 to 3 vials monthly. Many were rationing their doses, skipping injections to stretch their supply, landing in the ER with diabetic ketoacidosis. Our insulin costs $8 per vial, same formulation, who proved manufacturing. He wanted to buy 500 vials. I had to explain, us import regulations make this nearly impossible. The FDA requires extensive approval processes even for identical medications. So my patients should just move to India?" he asked, frustrated. "Because it's apparently easier to relocate internationally than to afford American insulin prices." I had no answer. He told me about a patient who'd started a GoFundMe to buy insulin. "In America, we crowdfund medical care like it's a charity case," he said bitterly. "Insulin was invented in 1921, costs dollars to produce. And somehow, we've turned it into a luxury good. I'm a hospital administrator in Buenos Aires, and we specialize in cardiac procedures for international patients. Last quarter, an American couple flew down for the wife's coronary bypass surgery. Top surgeon, modern facility, 5 days hospitalization, full cardiac rehab program. Total cost, including flights and 2 weeks recovery in a rented apartment, $22,000. Back in Nevada, the identical surgery was quoted at $170,000 before insurance. $58,000 after insurance with their deductible and out-of-pocket maximum. We're saving $36,000 by flying 5,000 miles and taking a month off work," the husband said. They'd consulted with our surgeon via video conference, reviewed his credentials, spoken with former patients. Everything checked out. "The absurd part," the wife said post-surgery, "is that our insurance company suggested we do this. They have partnerships with hospitals in Mexico and Costa Rica for procedures. They'd rather pay for someone to leave the country than negotiate reasonable prices with American hospitals." She showed me a letter from her insurance company encouraging medical tourism, offering to cover international procedures at higher reimbursement rates than domestic care. "The system is so broken," she said, "that even insurance companies are telling people to leave America for medical care. I'm a medical tourism coordinator in Dubai, and last month, an American man called asking about cancer treatment. Stage 3 colon cancer, needed surgery and chemotherapy. In Houston, his insurance approved the treatment, but his out-of-pocket cost deductibles. Co-insurance, uncovered medications would hit $85,000. He'd remortgaged his house, started a GoFundMe, and was considering bankruptcy. Our oncology center quoted $31,000 for everything: surgery, hospital stay, 6 months of chemotherapy, all medications, and follow-up care. I can fly my whole family to Dubai, get world-class cancer treatment, and spend 6 months in a hotel for less than my American copay," he said, voice breaking. He asked if we accepted payment plans. I explained we did, but most international patients paid up front to avoid us medical debt. In America, he told me, we don't have a healthcare system. We have a bankruptcy system with occasional medical interventions. He booked his surgery for next month. His teenage daughter asked if they could stay longer afterward, turn it into a family vacation. At least, he said, something good can come from my cancer. That conversation haunts me. The wealthiest country on earth, where people celebrate cancer treatment as an opportunity for international travel because it's cheaper than staying home. I confirmed his booking, sent the paperwork, and wondered how many more calls like his I'd take this year.